Hello, I'm Dr. Advaith Sai Goud, Consultant Cornea and Refractive Surgeon, Sai Jyoti Eye Hospital. Today we'll be discussing about cataract. Now, 1 out of 3 blind people in the world live in India. In India, approximately 18 million people suffer from blindness. 80% of the conditions causing blindness could be treated or prevented. Now, the most common causes of blindness are cataract, glaucoma, refractive errors, and retinal diseases like age-related macular degeneration and diabetic retinopathy. Amongst the causes of blindness in India, cataract is the most common cause, which is responsible for almost 60 to 80% of the blindness. So, what is cataract? Now, we all have a natural crystalline transparent lens that is present inside our eye. This lens helps us focus objects from coming from distance, from intermediate, and from near. Now, as we age, like how our hair becomes white, there's a chance that this lens also can lose its transparency because of denaturation of proteins and other pathological processes. Now, this causes the lens to become cloudy, and that is known as cataract. What are the complaints? What are the symptoms of patient having cataract? Mainly patient complains of diminution of vision during the night time or during daytime. Patient complains of halos or glare, especially during the night time, or looking at a point source like, for example, a light bulb, or when they're driving at night time, they see a vehicle coming from the opposite end, there's a glare around the headlight. Now, these are the normal visual disturbances that patient complains having cataract. This vision loss is gradual, painless, and slow. Coming to the treatment, what is the treatment for cataract? Surgery is the only treatment available for cataract. Now, this cataract surgery is safe and it is effective. There are mainly 3 different types of cataract surgeries. One is the conventional small incision cataract surgery. Now, in this surgery, it is done with a local anesthesia, and the size of the incision is about 5 millimeters, and we remove the cataractous lens and we place a artificial lens inside the eye. The second type, which is most commonly performed now, it is micro incision cataract surgery. In micro incision cataract surgery, also known as MICS, through the 2 millimeter incision, we remove the cataract through ultrasonic sound, and this is called as a phacoemulsification, and we inject a foldable lens inside the eye. And the third type of surgery, which is the most advanced type of surgery, which is called as FLACS, also known as Femtosecond laser assisted cataract surgery. This is the robotic surgery which is the most advanced, where with the help of a femtosecond laser, we make an incision and we break the cataract into pieces. Now, micro incision cataract surgery, that is MICS or FLACS, FLACS, these surgeries are performed under topical anesthesia. That is, we give eye drops to the patient that numb the eye, and the procedure should not take more than 10 minutes. Within this 10 minutes, we remove the cataract and we inject the artificial lens. And these are daycare procedures where the patient comes, get it operated, and you can go home within a few hours' time. Now, types of intraocular lens. There are various types of intraocular lens which mainly can be categorized into 3 types. One, we have the monofocal intraocular lens. Now, as the name suggests, monofocal intraocular lens, we implant a lens inside the eye. This lens helps focuses on the distance objects. So, after the cataract surgery, the patient would not be requiring glasses for the distance vision. However, patient might be needing glasses for reading purposes. The second type of lens, we have the multifocal intraocular lens. As the name suggests, again multifocal, there are 2 focal points. So, the patient won't be requiring glasses for distance and near. So, most of the time patient will be completely free of glasses. And then we have the third type of intraocular lens, that is the trifocal lens. In this trifocal lens, the patient will be able to focus on the distance, the intermediate, and near. So, intermediate vision, such the patients with trifocal lens will be mostly the patients will be benefited are patients who will be working in front of system for a long time, like people working in software or IT companies, people who do a lot of night driving where they need to look at the dashboard. These all fall under intermediate vision. So, patients with trifocal intraocular lens will be benefited from that. Now, recently we also have another intraocular lens that is called as the extended depth of focus intraocular lens. Now, these type of lenses provide an extended depth of focus from near to distance. It gives a continuous vision. Coming to the post-operative phase, the most important care that needs to be taken is no head bath for 2 weeks. So, completely the eye should be free from dust and water. There are no dietary restrictions, so normal diet can be followed. If the patient is using any medications previously before cataract surgery, for example, if the patient is taking any medications for hypertension or any diabetes, the patient need to continue the medications. Now, as it is a daycare procedure, the patient comes and gets it operated, can go home within a few hours time. So, the healing is much quicker, and patient can resume their normal duty from the very next day. So to conclude, cataract is an elective procedure. Previously, they used to wait for the cataract to get matured and then get it operated. But as now we're doing under micro-incision cataract surgery, which is done with the help of an ultrasound, where the cataract is broken down into small pieces, it is ideal to get it operated sooner than later, because if the cataract becomes hard, it gets difficult to break down into smaller pieces. So that could be leading to post-operative inflammation and edema and slower recovery. So cataract needs to get it operated when it is in the beginning stage. So cataract surgery is safe and effective, and the intraocular lenses that are used in the eye are of the highest quality. So the patients, depending upon what intraocular lenses they choose, they are completely free of glasses post cataract surgery. And as it is done under topical anesthetic drops, so the healing is much sooner, and patient can resume their normal duties from the very next day. Thank you.